Mosca. We are expecting 40 people or something. So
Wow.
it's not even 11, but yeah, we'll give it a few minutes for all those folks to join us.
Hello. Sorry, I was waiting.
Group, welcome, welcome. Bienvenidos. Hello. Hi, Cesar. Welcome.
Catherine, hello. This
Hi.
is Luz.
Hi,
Are you
Lisa.
going to start the interpretation feature or we waiting?
Yes, we are going to start it. Yaneli's going to start it for you. And I'll give an introduction with instructions in just a moment. Thank you. Nice to meet
Perfect.
you. Thank you,
Nice to
everybody.
meet you.
Hey, people are flowing it. Heather, I hope you're ready for a full house. She's a professor. She'll be
No
fine.
pressure, no pressure.
She's accustomed to the Zoom training.
I'm gonna give it until yes, I see the message there. I'm gonna give it until 11. Oh my gosh, it's 11:02. I'm gonna give it till 11:04 just to be fair. Voy a esperar hasta las 11:04 para empezar.
I'm looking forward to hearing about those updates, Catherine, that you're going to talk about.
I'm
Yeah.
gonna find everything that I can. One of the hearings is taking place literally right now.
Yeah.
Ngày lương miền Việt Trung
Yeah.
bên là thừa nè hai.
I think as much as we can provide, in terms of much as we know, is always good.
I'll give as much as I can. Wow. This might be the biggest group we've had, I think. Welcome, everyone. All right. We
Exciting.
are at 11:04 sharp. Um, Big welcome to such a big crowd. We're so flattered that so many of you have joined us. I'm going to start with Spanish interpretation instructions. So I'm going to speak in Spanish for a moment. Be right back. Muy bienvenidos a todos. Gracias por estar aquí con nosotros. Tenemos interpretación en español. Tenemos nuevas intérpretes, Catherine, otra Catherine y Luz. y ya está disponible si van abajo de la pantalla donde dicen interpretación y seleccionen Spanish. Entonces, voy a empezar y si tienen cualquier duda con la interpretación, si no está funcionando, por favor, nos manden un mensaje en el chat o también pueden mandar uno directamente a Yaneli. Gracias, Yaneli. Y sí, gracias por estar aquí. Okay, again, welcome everybody. I'm so excited to see so many people coming in from our TAPs, from our IPPs. My name's Catherine Ferry for anybody that I don't know yet. I'm the project manager for UC Davis for Latino TAP, and my pronouns are she, her, and ella in Espanol. And I want to recognize my colleagues here, Yaneli, Rachel, Carla, as well as our trainer, Heather. I just spoke with our fearless leader, Dr. Sergio Aguilar Garciola, shortly before this meeting. He wanted to be here. He was called away by another matter, but he sends his greetings to all of CRDP. And I don't want to talk too long because I know Heather has a fantastic presentation prepared for all of you. But I'll just brag a little bit about Heather if she doesn't mind really quickly. She's been with our TAP since the very beginning of phase two, so long time partner of UC Davis, and she is our go-to on many topics, including evaluation and this training that you'll see today is for grant writing, which is something that she teaches in her other life apart from Latino Tap, which is being a professor of public health at Sacramento State. So again, I want to thank the team for everything that you've all done to put this together, and I'll turn it over to you for now. Heather, one last tiny comment is that at the end of the training, we'd love it if you filled out our evaluation survey. It's just a few questions and it helps us improve our training content for all of you. So keep a lookout for that link in the chat. And with that, over to you, Heather.
It wouldn't be an appropriate grant proposal writing training if we didn't give you an evaluation at the end. Right? It's very appropriate. Okay, thank you so much, Catherine. I will get us started. So I have prepared a slide deck for us to navigate this presentation. However, I want to invite you, if you have any questions or comments, to please go ahead and place those in the chat. I will pause throughout the presentation and just turn to the team and say, is there anything that, are there any questions or comments that we should address at particular moments in the presentation? So again, I think Catherine gave me a nice introduction. I appreciate that. I think the only thing I'll add is my pronouns are she, her, and hers, and that I appreciate being here with you. So we wanted to start with a land acknowledgement. This presentation is being given and was created on Sac State ground, so we thought it was appropriate to have a land acknowledgement from that perspective. So we are mindful and acknowledging that the land that Sacramento State University is located on was and continues to be occupied by the indigenous people of this area, the Miwok, the Madu, and the Nisan. So the learning outcomes, just to remind you what those are for this presentation, is that by the end, participants will be able to identify 2 ways that their organization can improve their grant writing or their grant proposal writing process, that they will be able to describe 3 approaches to use when seeking potential grant funding opportunities, and will have increased knowledge in 3 areas of grant proposing writing that are resource heavy. For those of you that completed the survey that was sent out, we didn't have a huge response rate, totally understandable given all that's going on right now. Well, what I did is took of the survey results that were obtained or that were sent, I took them and organized them and focused this particular presentation and training on the 3 top things that were mentioned in the 2 areas that were part of the survey. The first asked about challenges, what challenges you all have for finding potential grant sources. And the second were challenges for completing grant sources, all sort of around the framework of those that tend to be a little bit more resource heavy. In other words, take more time, take more staff time, et cetera, et cetera. And so this presentation is focused on the top 3 for both. Oops, sorry about that. And then at the end, I'll do sort of an overall summary, just kind of organizing both of those. And then I've also added something that I've shared in a separate presentation, where I focused on evaluation about sort of and telling your story of your organization with data. I created a list of 8 ways that you can prepare your organization now for in the event that future funding becomes available and you need to organize quickly. And I've just attached those again to these slides in case many of you weren't at that presentation. And then this is me. And the reason I have this picture here is that I think I would have given a very different presentation a couple years ago. Right now, there are varying things that are occurring in the social political landscape that make a lot of some of these things that used to be very clear and certain a little uncertain. Things around data acquisition and trying to understand what the priorities at the national level are, et cetera, et cetera. So I give this presentation under the understanding of just that I completely recognize that this is a little bit of a different time. So please know that. Okay, so the results of the survey focused around challenges for finding potential grant sources. The 3 top things that were mentioned were finding state funding opportunities, finding funding sources with extended timelines, and then adjusting current programs or programming to match funder priorities. So let's address the first one. So I didn't want to assume that everyone has the same level of knowledge or understanding around funding sources that primarily fund the type of work that we're doing in CRDP that exist across the state or at the state level. And so I wanted to backpedal just a little bit to sort of set that kind of understanding first. So obviously grants that come from California governmental agencies, those are fundings that usually occur as a result of laws or policies that are passed. Oftentimes statewide funding or funding that comes from the federal government through the state. A lot of those are generally going through local community health organizations or through county departments of public health, and then community-based organizations. So just a sort of structural thing. One thing that we said very much in the beginning of the initiative of CRDP is that CRDP is a little unique in that regard, in that the funding was going directly from the state directly to community-based organizations and not through an additional local entity. The other thing is California Endowment. I don't know how many of you are familiar with the work of the California Endowment. I'm going to go into a little bit more discussion about specifically what they do, but the endowment does a lot of work in California and also does work similar to what we're doing in CRDP. There are many foundations that fund across the state in California, or I would say are very California state friendly. So the Robert Wood Johnson Foundation, the Sigma Group Foundation, the California Community Foundation, and I would say most specifically the California Wellness Foundation. And again, I'm going to go into a little bit more detail about what they do. So here are just some overall suggestions about when you're thinking or wanting to pursue something that is funded statewide or comes from federal entities or state entities, what are some basic practices that your organization might want to do to be aware of what's coming down the pipe or what's available, etc.? So one of the first things was to track and monitor federal and California Surgeon General priorities. So this is where that face that I gave you a couple slides ago comes into effect. is that it used to be that funding would be in alignment with what was important at the federal level in terms of the Surgeon General's focus, and then obviously at the state level in terms of the state Surgeon General focus. That is somewhat still true. But being aware as an organization regarding what is important is something that you should really keep attuned to. The other thing is that Assembly and Senate bills that come in front of both health subcommittees in the Assembly and Senate, those occur in April. So knowing when those health committee subcommittee meetings are and what's being pushed or what's coming down the pipe is also something to be aware of. There's also some websites that many of you may be very familiar with. For example, at the state level, state governmental grants and funding opportunities that are becoming available or are currently available. You can find those through grants.ca.gov. I wanted to kind of make a suggestion to you that when you're looking at grants in that infrastructure as well as other infrastructure, that you allow yourself some flexibility. For example, I know obviously CRDP is focused on mental health prevention, especially sort of early prevention, but you'll find that many of your own current programs or programming that you potentially might fit into that bucket could be found in other categories like tobacco, drug and substance use, or on the website searching under wellness funding or searching under funding that focuses on education, etc. So it's just a little thing to say, don't limit yourself by when you're selecting your keywords in some of these grant sites just by focusing on the thing that you specifically are looking for. And this will sort of relate to an example I'm going to provide a little bit later around sort of stretching what you do in ways that can help you to still seek and obtain funding, but might mean you have to adjust slightly. The other things is creating relationships with other organizations that do similar work like you do. And understanding where do they get funding from, right? This will help you to understand what certain funders are more interested in than others. I realize that can be a competition piece here, so I want to be mindful of that sometimes is an issue. But paying attention to what are other organizations that are doing similar work or work that you want to do, where are they getting their funding from? And that helps you to understand which funders are interested in funding that type of work. Okay. And then obviously we all are looking at Prop 1 funding, paying attention to the population prevention funding and the innovative partnership funding that's coming. I know our team has been going back and forth and talking about ways to keep you as informed as possible, at least within our hub. I'm going to turn it to Catherine now for just a second because it sounds like she has some maybe updated information for us. And I'll stop sharing, Catherine, so you can... Sorry, let me just get to okay, there you go.
Hi, everybody. Yeah, thank you, Heather. I know in speaking to the IPPs that I have in the last week or so, there's been a request for up to the minute update on the Prop 1 funds. So I just have 3 slides. I don't want to take too much time away from Heather's presentation. But okay, how's that looking? Okay. Yes.
We see your notes. So if you like go with display settings and then switch if you go up top, that it says display
Yes.
settings. Yeah, and then if you do swap, yeah, there you go.
Thank you. Thank you.
Yes.
Okay. Yeah, so I think the biggest thing that I want to say about the Prop 1 funds, and I know we have some people that are very new to CRDP, so I'll just say Proposition 1 was a law that passed in 2024 that affected the Mental Health Services Act. So there's a big shuffle going on right now of funds that used to be distributed by counties to funds being distributed by states. So this is a big shakeup that we've been following very closely for quite a while now. So I'll give a brief overview. The biggest takeaway I want you guys to have for today is to be attending the CRDP Cross-Population Sustainability Committee meetings and following those updates. That's Josefina, Stacy Hiramoto, and Joel Baum put all of that together. If you're new, you may need to email Joel to start getting any calendar invites. But they, our TAPs, we are researching this, as Heather mentioned, we're going to meetings and everything, but the CPSSC has a team that can do the analysis of all this information as it comes out. So be sure to be attending those meetings. They also get recorded in case you can't make it live. So there's a lot of information coming out right now about the development of these funds. So just to give a recap of what the different funds are, um, the first one is population prevention. This one is under the jurisdiction of California Department of Public Health. This is $100 million statewide over 3 years starting July 1, 2026. There's more, if you really like to know more information about this fund, we can provide, what we do know about this fund so far. I can put some links in the chat. It does include designated funding for CDEPs, which is great. That was something that the CPSSC and many from the CRDP initiative advocated for. In addition to CDEPs, it funds several other categories. One example is technical assistance funding. Innovation Partnership Fund. This is also coming from us, or will be coming from a state level agency called the Commission for Behavioral Health. There was supposed to be $20 million statewide annually for 5 years, for a total of $100 million starting on July 1 of this year. We just got word that there's a proposal on the table for them to invest this money differently. So that it's a potential that there could be a reduction in this amount. And again, here, CDEPs are specifically named in the framework of this fund and outline, which is something that you can read. Finally, early intervention funding. This will be distributed by the counties. For those who have been around a while, the Mental Health Services Act, counties funded PEI, or Prevention and Early Intervention. That changed with Prop 1. The state now distributes the prevention funds, as I mentioned at the top, and counties will fund the early intervention programs. This is regulated by DHCS, meaning the funds will come from counties, but they will have to follow guidelines, requirements from DHCS, the Department of Healthcare Services. And those guidelines are kind of coming out now. I must say I'm not the expert in this. I'm going to underline, please attend the CPSSC meetings where you can listen to someone who's more of an expert. But they are developing guidelines for how and which CDEPs can be funded by counties. Last slide is kind of where we stand with these different funds. For population prevention, we're waiting on the approval of final guidelines that many of you weighed in on, gave public comment on at the end of 2025. These were supposed to be approved at the end of December, got delayed again. So we know that has to be an announcement of that approval has to come out before an RFP can come out. So not sure of the timeline right now, but let's all, get ready, attend what meetings we can, including tomorrow. And I just looked this up moments ago. There is going to be a panel on the population-based prevention fund. It's actually not by CDPH, it's by the other organization, CBH, Commission for Behavioral Health. That's taking place tomorrow. I'll put the information in the chat. It's tomorrow at 9:30. And next, for Innovation Partnership Fund, the outline of this fund is being reviewed by the commission literally as we speak. So we should have more information about this later today. The commission had announced at a previous meeting, I think it was back in December, that RFPs could come out for this as early as mid-February. And for the early intervention funding, as I mentioned, I am relatively ignorant on this topic. We will follow up. Please talk to our CPSSC colleagues. Please attend those meetings. Can't say that too many times. I can give you a major takeaway. I worked at Encounter County Behavioral Health for about 5 years. It's very much about relationships at the counties. Of course, they have their fund development process, but it really benefits those who are working in that sector, the nonprofit community, to go to as many meetings as possible, make some partnerships, get to know people, get to know how the county works, how it is changing, and it's changing a lot right now. So you have your BHSA meetings. They also have Cultural and Linguistic Competence Committee meetings. They have QI meetings. There's a lot of meetings if you ask around. And I recommend at this juncture, attend everything that you possibly can. And I'm happy to, if anyone has any questions, to answer that. Back to you, Heather.
You're on mute, Heather.
I said I know that we're giving you a lot, and I hope that's why you're here. And there was a question also about whether or not we'll be sharing the materials, and the answer is yes, the recording and all of the slides. So you will also have these in other ways as well. Okay. Let me talk about the California Endowment. So I don't know how many of you are aware of the work that they've done or that they do. But the endowment started in 1996, and it was created as a result of Blue Cross of California acquisition of Health Network. So often people are confused about what an endowment is compared to a foundation. So an endowment is basically a financial gift to a nonprofit organization that essentially is invested, and the excess can be used to essentially give out to other organizations and entities that are existing that are doing work that the endowment supports. So the endowment is most known for their Building Healthy Communities work that they've done. If you're not aware of what work the endowment does, they do a lot of race and place-based focus on equity, mental health equity, financial equity, justice, all kinds of different things. And Catherine sort of walked me right into this, but the California Endowment is also very much focused on, very much focused on relationship work, meaning that the staff members and program managers that work for the endowment, you really want to make sure that you're aware of who your endowment officer is that serves your geographical area and establish a relationship with them. Because they are, I've found in the work that I've done with them over the years that they are very grounded individuals, and that they will keep you abreast as to what's coming down the pipe for new initiatives, work, etc. Okay. Some statewide foundations. I mentioned a few earlier. I want to specifically focus on the California Wellness Foundation. I've also done some work for the California Wellness Foundation in the past. It's one of the largest public health philanthropical institutions in the state. Again, it was created as a result of when HealthNet, the insurance company, went from a not-for-profit to a for-profit entity. This foundation was created. I have here, I'm not going to go into super detail about what they're currently funding, just wanted to kind of give you the categories so you can see how closely they connected to things that we find of value in the CRDP work: community well-being, equity and access, economic security and dignity, leading power for change, etc. So if you're not familiar with the work of California Wellness Foundation, I would suggest that you poke around on their website, look for some of the things that they've recently funded and projects that they've funded, as well as organizations. Some of you may even know of partners that have been funded. Another thing I really want to make sure to talk about is something that I'm really, really involved with, and that is hospital community benefit funds. So each hospital in the country is federally mandated to essentially assess the needs of the community and then invest a portion of their revenue back into the community to address specific health needs that are identified. I realize this is not necessarily a statewide funding entity, but I wanted to talk about it because we have hospitals all over the state. So it is an entity that I really feel like many of our CRD partners tend to not tap into. And I've been involved with it because I've been doing community health needs assessments and community implementation planning consulting for the last 20 years from hospitals across the state. So just from a process perspective, essentially the way it works is that first a community health needs assessment is done, and hospitals are mandated to do these assessments every 3 years. And then the hospitals are mandated to take that assessment and create implementation planning with it, which means they have to invest a certain portion of their revenue by funding organizations and programs that address the needs that were identified in the assessment. Also, the federal government requires that the focus of this work be focusing on those that are disproportionately impacted, and they use a lot of mapping and data analysis at the most granular level as possible to identify these populations, locations, etc. I wanted to give you an example, and so I chose the area of Ventura that is served by one of our IPPs, MyCop. And literally, I Googled which hospital or hospitals are in Ventura County, and I identified that Community Memorial Hospital of Ventura County did a community health needs assessment with Community Memorial Hospital of, I believe it was Ojai, and they did a partnership CHNA or community health needs assessment. And in 2025, the top 3 priorities or health needs that were identified were behavioral health, older adult health, and women's health. So what this means is that the community benefit wing or entity of this particular hospital now is going to create an implementation plan focused on these 3 priority areas that were identified in the health assessment. I can't help but notice that behavioral health is on the top. So then I also looked at, okay, these were the top 3 health needs for Community Memorial Hospital. Then what did they propose that they were going to fund as an implementation in their implementation plan? And then I looked over here to their implementation plan, and you can see here it clearly indicates what they're going to support, what they're going to fund, and then it shows the organizations or partners that potentially they're going to work with. So every hospital, especially not-for-profit hospital, I should say almost every hospital, but especially not-for-profit hospitals, this is an IRS mandate. So I really want to encourage you, if you haven't tapped into this source, that you identify your local area hospital and or hospitals that serve your county or potentially your geographical area. I'm happy to help if you want to reach out to me. And when was the most recent community health needs assessment done? And the priority health needs that were identified in that community health needs assessment, have they already developed an implementation plan? And does that implementation plan focus on the areas that your organization serves? Apart from that, get to know your community benefit officers, the folks that work for the health system or the particular hospital, because they really are looking for people that are going to be able to address the populations that were identified in their health assessments, as well as the particular areas of need. Okay. Sorry, I had some magic there, but it didn't turn on. All right, now I'm going to move to number 2, is funding with extended timelines. I do want to say as a caveat, I wish I could tell you that there were a gazillion of them out there that will fund for 6 to 10 years, but unfortunately that's not the case. So federal and state grants, usually those timelines are about 3 to 5 years. Being mindful, of course, of the priorities of the large organizations at both the state and federal levels, knowing what the priorities are that are being focused on by the federal administration and the state administration helps you to understand whether or not you fit into that, as well as whether it's in a sustained type of work that you can do. Private foundations, generally, again, those timelines are 1 to 3 years. And then most commonly, there's a 1 year timeline with renewal in many cases. And this is where I also want to backpedal and say what I was just talking about earlier around community benefit office staff, our community benefit staff at the local hospitals, as well as relationships with your county behavioral health officers. As Catherine said earlier, this is very relationship focused. It's also very relationship focused with your community benefit officers. So although it might be a 1 year cycle, if you have that established relationship and you can also demonstrate that the money is being used in a way to reach the outcomes that you're intending, then it doesn't necessarily become a 1 year cycle, if that makes sense. Okay. Also, I want to turn you on to another potential entity that you should maybe be aware of, and that is the Northern California and Southern California Grant Makers Organization. These are two separate nonprofits, but essentially they consist of a group of individuals working for philanthropical organizations that have gathered together to really try to work together to move the needle when it comes to health equity, mental health equity, social justice, etc. And the reason it was created is because they were finding that they were sort of funding things separately, not being really aware of what other philanthropical organizations were doing. So if I were an organization, I would definitely subscribe to their newsletter and track their work and look at what they're talking about at their meetings, what's interesting to them, what's at the forefront of the work that they're doing. You can literally just Google Northern California grant maker, Southern California grant makers, and they pretty much have divided the state in half. Okay, the third thing that was mentioned regarding acquisition of grant funding was adjusting your current programming. So this is, I think, going to be more from a philosophical maybe perspective, or a more sort of kind of focused more on like leadership, if it will, and leadership approaches. So I think, thinking about the ways in which your program can be stretched is important. I know you probably think about this all the time, but I almost think about it as like cross-training in exercise, right? So, for example, if you're not getting the results that you need, or you need to be, adjust, or you need more flexibility, you might be doing more stretching or yoga or those types of things. So allowing yourself to be a little bit more moldable as an organization to the best that you can is obviously important. Totally recognizing that large-scale changes to the way that you implement things is much more difficult, totally understandable. But are there ways that you can stretch here and there with your programming that may make you, available to acquire other types of funding? The other thing is that adjustment of your programming always requires inclusive conversations and flexibility with your staff, right? And as a team, right? About what's occurring in the funding world, what's not, how can you mold and adjust, but always making sure that your staff already aren't working at the capacity of their workload, so that they feel like they have that ability to mold and adjust a little bit, and not potentially look at it as you're asking them to do one additional thing that maybe they're not doing already. Okay, so I wanted to provide an example of Latino service providers. I saw that Stephanie and Magali were on here, so please, Stephanie and Magali, if I hope that I represent you adequately. But when I was thinking about this adjustment and change and moldability, I was thinking about Latino service providers. So Latino Service Providers is an IPP in the Latinx Hub, and essentially they started with having youth promotores or youth, basically educators, promoting health and well-being in the community, focused specifically on mental health. They do mental health well-being and workshops. They have gatherings and a lot of other stuff that I don't want to go into for timing. But what they did is that they sought additional opportunities for youth to still practice the skill set that they were learning and the training that they were giving as youth promotores, by identifying other sources of funding that would still allow them to attach that mental health education and wellness work they were doing in the community, but be slightly maybe adjusted. So, for example, they sought emergency preparedness funding, obviously knowing that they're in Sonoma County, California. They were dealing with fires, etc. They also turned, they continued with the model, of course, of mental health awareness and education, but it embedded in that emergency preparedness approach. They have since, I think at one time they had up to 7 tracks, and each of those 7 tracks had a slightly different orientation. They had a mental health track, as obviously through CRDP. They had an environmental track, which I love the name of because it was Promotores Verdes, which I thought was just amazing. The emergency preparedness track, an art track, and a bunch of other tracks. So a lot of these that they had were acquired through different funding sources that allowed them to take the skill set that they still had at the center of their CDAP, but adjust in just slightly different ways. So this is what I'm referring to about that sort of slight flexibility and adjustment. Okay. The other thing is, from a leadership perspective, I think it's important to create a culture of flexibility within your organization, again, as much as you can when it comes to funding. An organizational culture that is flexible to modification is going to be helpful when you're asking your team or your team's being pulled to adjust and modify in a different way. The other thing is hiring a staff that can cross-train. So when you're hiring staff on your team that, for example, I gave the example of, hiring someone that has a master's in public health. All masters in public health students are trained on grant proposal writing. So hiring in a way that allows for that sort of bending and acquisition across potential funding sources can be helpful to you. And, we already talked about visionary and inclusive leadership approaches. So that means that your team knows where you're going, right? And also that it's inclusive of their voice at the table around the need to potentially be flexible, mold your intervention or your CDAP in a certain way to be able to allow yourself to be more attractive, let's say, to a potential funding opportunity that's coming. And then infrastructure, again, that encourages a growth mindset, always expanding, always adjusting within, of course, the understanding that I realize that often, working directly with and serving the community, the needs of the community come first. And I totally recognize that. But a lot of this sort of bendability and flexibility of attraction to other funding sources starts with building a culture, right, within the organization that that's what you do. Okay. I want to just take a second here. I know we spent some time pausing for Catherine's presentation, but I wanted, maybe we don't take 5 minutes, but maybe like 2 minutes, and see if there are any questions in the chat that I can answer, or any comments, or anyone that wants to chime in.
Hi, this is Francis Saunders from California Black Women's Health Project. Thank you so much for the information so far. I wondered about the hospital assessments. Are they readily accessible to us and able to just find it on their website?
Yes, yes, and yes, absolutely. Yeah, they all have to be posted. And I'm happy to, I didn't catch your first name, I apologize. I'm happy to help direct you also if you want to shoot me a message in the chat and with your email, or if you want to email me directly, I'm happy to help you identify your closest hospital and your closest assessment.
Thank you.
Yeah, and sometimes it's not just one hospital. Like I'll give you an example. In Sac County, there are there's one joint assessment that's done, but it includes 3 different hospital systems. So each one of those hospital systems or hospitals are going to have different implementation plans. Yeah.
Heather, there's a question on the chat. I don't know if you got a chance to see it
From
from
Caesar.
Caesar. Yeah.
Will there be time to discuss systems change work funding, especially around justice involved work where less restrictive programming should be outside of detention facilities? Have there been conversations with OYCR about LRP funding such as diversion? I'm not sure I know what OYCR is. So do you want to?
Yeah, first and foremost, thank you for the presentation.
Sure.
I have some questions on regards of communities setting narratives instead of foundations setting narratives for communities in regards of what funding and how funding could be better improved in regards of inclusion of communities. Because some of the things that have been learned through California's endowments, great attempt to be in community and be inclusive, but there's been a lot of exclusive approaches and practices. And I think that's something that I think we as community who are on the ground doing the work should have learned from, or at least have more conversations amongst ourselves to have better ways of not just civic engagement, but ways of doing like really good work in community. But going to the most important thing, which is the less restricted programming, the OYCR is the Office of Youth and Community Restoration, which is through the state that oversee some of the funding from the closing of CYA, which is the California, right? So it's now where there's more conversations and better advocacy and regarding what those programs should look like regarding rehabilitation in at the facilities. I say this because for the past few years I've been given an opportunity to work at with Dr. Garcia's guidance on how to do better programming and take away the recidivism of young people going back to jails through mindfulness practices and mental health work that we do. And so I'm looking more in depth of the situation of funding that allows for system change in the way of we are approaching these written policies, right, to reflect better the practices of less restrictive programming, better definitions of what that looks like in community. And so that's why
Yeah.
I ask if there's conversations or opportunities or where we can be more than just providing the services, but providing maybe more of that old school direct action work. And so how do we, best approach funders who are more I guess, respectful to communities, right? But I think one of the issues that I was mentioning before that we've learned from the endowment is that as communities we have learned also the exclusive practices, right? Who gets
Agreed.
to run for office or are in those conversations with certain elected officials. I think that's something that I'm hoping in the spirit of really good community organizing that we have better not just understanding but conversations of how we can do better in regards of how we're funding our communities.
Yeah. Cesar, I deeply appreciate your comments and couldn't agree with you more. I think one of my perspectives is that we first have to get at the table. And,
Great.
this presentation is not necessarily focused on the advocacy of changing funders' approaches of inclusiveness. but it also is given under the understanding that that is a barrier. And especially, trust me, I have my own opinions about the endowment that I won't go into, about work that I've seen them do or not do around inclusivity. So I don't know specifically if this presentation is going to address the question that you posed around the specific youth justice work, but we can have other conversations. I can definitely loop back in with Catherine and Carla, who I know that you all meet with frequently, and see if there's anything I can find out about that. But thank you for bringing up something that I meant to say in the beginning, which is there's still a lot of adjustment and needed change culturally with funders that needs to occur. And yeah, the fight is still, we're still in the fight, I guess is what I'll say. Okay, I'm going to continue because I want to make sure we stay on timing track, but thank you for the really meaningful comments, and please, I want to continue to invite you to place those comments in the chat. Okay, I'm going to move on to the next question that was in the survey, which is challenges for completing grant sources. I'm going to talk first about data justifying the need for funding. That was one of the ones that was mentioned the most. Making your proposal or your proposed work stand out from other organizations, and then evaluation to demonstrate effectiveness. These were the top 3 things that were mentioned. So one of the things I start with in my grant writing class at Sac State is I start at the very beginning of the semester, and there's a lot of anxiety in the room because students are like, oh my gosh, we're in a grant writing class. And I tell them all grant proposals have the same basic components. So it doesn't matter if you're applying for a CDC grant or a CRDP grant or a small based grant from a very small funding agency, they all have the basic components. One might be more complicated than the other, or might ask for more specificity, but these are the primary components they have. So they're all going to ask for some type of problem statement or background or justification for what is the problem, who is the problem exist in, and where is the problem geographically located. And, the idea is to be really clear about helping them to understand, for those that you're writing the proposal to, what those things are, right? And then that leads you to the second thing. You've stated what the problem is, and now you're saying, okay, here's what we would like to do to address the problem in terms of here are the goals of our proposed work that we want to do, and here are the objectives of the work that we want to do. And then the strategy, which is the next part, is you describing what you're going to actually do, right? We're going to do this, we're going to do that. This is your CDEP, if you will. And then you have to state how you're going to prove that you did it, right? So you're going to evaluate, you're going to demonstrate its effectiveness. There has to be some component where you talk about your organization. I call this organizational capacity because it just basically means that you are gloating about your organization's capacity to perform the work. Of course, there will also be a budget in there. You might have some support letters or staff profiles, and I'm sure there's a lot of other little minutia. But in a nutshell, this is the nuts and bolts of a basic proposal. So when we talk about the data to justify the need for funding, it's really important that you have strong background data. This is really important. When your proposal comes across a funder's desk, they're thinking, of course, as we've already talked about, the potential relationship that you might have with them, but they also want to make sure that you're making a strong case for the particular, to solve the particular problem that you're wanting to address. It's important that you know the funder's priorities and the frame of the funder. So some of this has already been mentioned. What are they most interested in funding? What have they announced publicly that they will fund? All of those are things that you want to try to see, does this data, does our approach, the things that we're wanting to do, does it fit into this perspective? Of course, keeping in mind what we also just talked about around molding that as well. And use data that's accurate, credible, and reliable. And how do you know? Well, it comes from reliable sources. It comes from entities that have been around for a long time. It's not one little independent study that was done per se. Although sometimes when we are looking for data or information and there are no other data sources available, we have to make sure that we have to rely on small pieces of data. As long as it's not an opinion piece, which is different, then obviously that's something that can be used. I would also say becoming familiar with the difference between data that is collected through what's called active versus passive surveillance. So active surveillance data is that there's an entity that actually goes out and collects that data, right? It's an active, whereas passive surveillance is it's data that's collected through a mechanism that already exists. So this would be things like your mortality data that is mandated to be reported to the California Department of Public Health, right, to your state entities, or mandated infectious disease data, right? That all comes from medical providers, from medical entities, so that's passive. So knowing the difference between whether data might be something that's collected by someone or you have to go out and collect it versus passive is important as well. And then show how the data for the population that you want to serve, show how it compares to relative benchmarks. I think that this is one thing that I consistently see organizations fall short with. Just merely stating this is the percentage of the X number of adults that have depression in Sacramento County, without showing how that compares to some relative benchmark or showing how that has changed potentially negatively over time, it leaves the reader with, okay, is it a good number? Is it a bad number? I don't have any comparative to it. The other thing is showing the disproportionality or disparate conditions of how it exists potentially in certain population groups compared to others, which I know you are all very, very good at, but also that is important also. And then the last thing I'll say is also showing the human side of your proposed work. So things like a bio of the community that you're wanting to serve, or a photo of community members, a direct quote from the community that's being disproportionately affected. All of those are also important. Sometimes funding agencies don't want you to include that thing. Sometimes if they're vague, I always encourage include it. And I'll explain a little bit more later. Okay, so I wanted to give you a few examples of what I mean about like passive versus active surveillance, as well as what I mean about benchmarking and those types of things. I am really attempting not to lose you all talking about a bunch of data and numbers, so hopefully I don't. I wanted to give you an example from the Mental Health America, which is a not-for-profit organization. And they have an online screening program with 200 nationwide affiliates. And what this consists of is that at these nationwide affiliates, which includes a phone app, patients and individuals can self-screen for various conditions. One of the instruments that is available is the PHQ-9, which I know we're aware of, regarding assessing depression and anxiety, as well as the post-traumatic stress disorder screening is available as well. This data from these instruments is collected and aggregated locally locally as well as the county, and then sort of rolled up to the state and national levels. So this is an example of active surveillance in that it's an entity, Mental Health America, that's attempting to examine how many people exist out there with depression, anxiety, as well as PTSD, to have an understanding at the national level as well as local levels, what we call prevalence, or the number of people that have these conditions. So they have taken this data and organized it on a data platform, as well as on their website, et cetera, et cetera. So I want to show you a little bit about the way that it's organized. And you can go on and mess with this data platform in a bunch of different ways if you're interested in this. Some of you are really interested in this stuff. This is also what we call a data dashboard. So a lot of entities right now are putting their data on data dashboards to try to make it a little bit easier. So let me get my pointer here. So over here, it's basically saying this is how many people were screened by state. And I realized that when I captured it, I did not capture California, so I apologize. And of those that were screened, how many of them were showing signs based on the questions on the two different instruments? How many of them were showing signs of these various items? So this tells us literally just the number of people that were screened. Interesting. Over here, this tells us a little bit more about the how this data looks when it comes to, specifically this is filtered right now for depression, how this looks in terms of where different states fall and the number of people that score high using the PHQ-9 when it comes to depression. So the darker the color of the state, the worse off the percentage or the higher the rate of individuals that were screened showing depression. So one thing I want to point out to you here is that California is not super high, right? California does not have the darkest of the blues. And so nationally, I might be more interested in the areas with the darkest of the blues, right? But when we look within California, that's what this map over here allows us to do. This map organizes the same data, but it organizes it by county. And in this way, it allows us to see that although at the state level, when we're applying for, let's say, national funding, the state might not look like it is that bad in terms of particular indicator, but at the lower level within the state, we're going to see some potentially not so desirable rates of certain health conditions. Okay, stay with me here. Give me 1 second. Sorry, nobody else can notice that the dog needs to go outside. I apologize. I want to also point you to the California Health Foundation, Healthcare Foundation. If you're not aware of the various reports that they are generating around various mental health conditions, I think that you may want to explore a little bit. I pulled up this particular one because it provided the example that I wanted to look at. But again, in this report that came out in 2022, California was doing pretty well when it came at the state level to the national benchmarks that were set. So when it came to various types of mental health outcomes, California didn't look so bad. However, what they did notice is when they compared California rates over time, that the rates in California, although they were better than the national, they were trending upward when it came to various mental health conditions. They also looked at different groups, right? And obviously, we as being in CRDP, we know that with different groups, whether they be gender or race and ethnicity, etc., we see those different patterns in different groups, of course, with diverse communities tending to have higher rates when it came to sort of the overall rate. And I want to kind of point you to this one graph right here, where you can see that this is graphing essentially adults with severe mental illness and children with, I believe it's severe emotional disturbance by region across the state. You can see that what this allows us to do is to compare different regions, allows us to compare children with adults, but down here is really what I want to point you to. This is the California average for both conditions. So if you were writing a grant proposal and you wanted to use this data, you would want to be able to ask yourself, can I show that the data in my area is performing poorly against a relative benchmark? So in this case, the California average would be your relative benchmark, right? And we could see that the San Joaquin Valley is performing relatively negatively. Northern and Sierra area is performing relatively negatively. Inland Empire, right, to this particular benchmark. And then the same would be true for children. But using that benchmark comparison is really important, and it's important to funders because they want to know that there's a disparate condition occurring. Okay, hope I didn't lose half of you. I wanted to show you another example of how when you have data at the aggregate level, at the state level, at the county level, or at the national level when you're looking between states, how sometimes California performs pretty well. And so when you're applying for large-scale funding, it can be really challenging. Your county might perform really well. And so how do you write your grant proposal in a way to basically say, although it's performing well at the more higher level within the community, here's what we're seeing. So in 2012 and 2013, I worked with a team of grant writers to secure funding for Sacramento County as a part of the CDC's community transformation funding. Specifically, our team of grant writers worked for the Sierra Health Foundation, which is a foundation that locally primarily serves the sort of Northern California Sierra region. This particular funding was focused on Sacramento County. We realized very early that using California-based data and even Sacramento County data was not going to serve us in the grant proposal because we actually were doing pretty decently. So what we did instead is looked deeper at the local level, census tract, zip codes, and showed how certain locations and population rates were not performing well compared to the overall state rate. And we actually included this exact picture and the concept of what is an iceberg in the proposal, which means on the surface, things looked okay in Sac County. But when you go deeper in the county, you can see that there are populations disproportionately being affected as well as certain geographical areas. So I encourage you to do that. The other thing, as I mentioned earlier, case studies, bios, stories of the communities that you serve that are being disproportionately affected. Tell the personal side of the communities that you serve. Put a picture in your grant proposal. Put a story, a narrative in your grant proposal. Evaluation, if we've learned anything in CRDP, is not just about numbers. I know we've sat through many a presentation where we've said this doesn't really capture the human side of the work that we've done in CRDP. So I want to invite you to do that in proposals. Funders are literally staff people sitting at a computer, just like you are right now. And they have hearts, and you want to pull on those heartstrings. Stories about people actually stay with them. So those are the things people remember. So I want to encourage you to do that. Okay. The other thing is this is just a table. I'm going to go over it very briefly. You'll have it in the handout when it's sent to you. I was thinking about what are the places that I pull on the most for accessing data at the local level when I'm helping an organization with grant writing, or I'm teaching grant writing, and so I wanted to point these to you and to tell you why. So I've already talked to you about the community health needs assessments that occur from your local area hospitals. One of the strengths of this is that it requires by law in the community health needs assessments that they include both quantitative and qualitative data. So these can be documents that can be very helpful to you in terms of organizing quant data around a particular topical area or geographical area, as well as quotes and qualitative themes and things that the community is saying about the health needs in your area. So they can be helpful to you to find that data that you need for that proposal. And benchmarking is required in community health needs assessments. So the IRS government requires that you benchmark to both state and national rates, sometimes even to county rates. So those benchmarks can be contained in those as well. The other thing is that they're done every 3 years. So they're oftentimes more recent than other big reports, like even the California Healthcare Foundation I was just showing you from 2022. They can be more recent. County Department of Public Health. Most public health departments have data dashboards. And those data dashboards will include all the mandating reporting conditions, as well as some that are not mandated. So I want to encourage you to, again, look at your county public health departments. Post-COVID or during COVID, it's a little confusing. There was some money that was thrown at county departments of public health to create data dashboards. Some counties applied for it, some didn't. But if you just type in "Be Healthy" and your county name, they may or may not have a data dashboard that you can use and access. California Department of Public Health, they also have a data dashboard called Tracking California. Keeping in mind that for mortality data or death data, or again, anything that's mandated to be reported at the state level, the California Department of Public Health is going to display it for you, going to give it back to you in some type of report or data dashboard for you to access. It is organized at the state level, but often also organized at the county level, sometimes even zip code, depending on the condition and mortality. You have to be a little careful around death and organizing data at the zip code level if it's an uncommon condition. And then all of your data that uses rates, population counts, like percentage of ethnicity or percent gender, etc. I shouldn't say gender, sex, etc., or maybe sometimes even gender. It's all organized by census data. So knowing also how to access your census data is helpful as well. Wanted to show you just what the Tracking California website looks like. This is organized by California Department of Public Health. These are the current conditions that are on the Tracking website, Tracking California website. You can click on each one of these and it will show you the most recent data and how it's organized. Okay. So just a couple final comments about data used to justifying a need for funding. I mentioned this earlier, but lean on documents that like-based organizations have created. Because a lot of times when you're writing that problem statement, one of the things I think is I find that organizations feel like they have to open a brand new Word document and start from scratch. Yes, that's true, but a lot of other organizational reports that have already been done are things that you can lean on to say, where are they getting that data that speaks to blank? Oh, yes, that's right. It's from this organization. So you can use other like-based documents to identify what other entities, where those entities that might have more resources than you are pulling their data from to state their case. And I was going to pull this up, but I won't for the sake of time. In the most recent draft of the SWAY evaluation report, for phase 2 extension, the entire first portion of it is the justification for the CRDP work. And if you open it and you look at the sources that the SWAY or PARC is providing, you will see the sources of where they're getting their data from or their justification for the background for the work that you all have done on CRDP. Again, that's an example of you identifying potential areas or places you can go. I wanted to also show you just an example of active versus passive surveillance for data. An example of active surveillance is the Trevor Project. The Trevor Project focuses on mental health status specific for LGBTQ plus communities, and they are actively engaging in a number of partners nationally that serve LGBTQ plus communities, and have them collecting data specific to mental health and mental health related status. But their data is contained on their website as well as in a report. And then we already talked a little bit about CDPH and the mandated mortality data. And again, their data is on their website, and I've provided the link for both of those. Data about individual behaviors and individual health status is usually collected a little differently. And individual health data is often most collected via active surveillance, which means that people have to go out and get that data. So the common surveys that collect behavior data are pretty much these. Sorry. The BRFIS is the Behavior Risk Factor Surveillance System. This is a national-wide survey that is administered via the state contract. Sac State actually had this contract for the last couple of years, and they're still doing phone surveys, so calling people in areas throughout the state and asking them to complete a survey. The Youth Behavior Risk Surveillance Survey is done still through the school system, but its focus is on behaviors like, the same thing that's in the BRFIS, slightly modified for youth, but focusing on like exercise and, the question about in the last 21 days, have you felt like you didn't want to get out of bed? Or in the last 21 days, have you felt depressed? Those types of things. That 21-day question actually comes from the BRFIS and the Youth Risk Behavioral Surveillance Survey. The CHIS is a statewide survey, comes out of UCLA. Many of you have probably heard of that. Through the school system, if you want youth data, the primary youth data survey is Youth Truth. Many of the school districts are turning to the Youth Truth survey or the California Healthy Kids survey. Surveys for specific population groups, like surveys for Indian Health Services. There are parameters around being able to access that data. You must be from a tribal entity, but that would be an example of how data specific for a particular population or population groups might be available. And then the Trevor Project, again, as I just mentioned to you, focuses on LGBTQ+. So the whole point of this particular slide is to say that if you're interested in identifying behavioral data, not like death data or number of people that have a condition, prevalence data, that data is usually going to become from an active approach by an entity, and these are the most common ones that are used. Okay, the other thing is in your proposal, how do you organize your data? So I always recommend that you organize your data from a more sort of global or broader perspective, getting more specific. I train my graduate students and the organizations I do grant writing with, to start nationally. What does your topical area look like? What does it look like at your state level? And then how can you get it as local as possible in terms of the condition and population that you're wanting to serve? You're essentially telling a story. You're essentially telling the reader, this is the condition at the national level, here's what it is within the state that we live in, and here's what's going on locally that we really want to address. So that becomes your focus. You're sort of leading that reader right to that focus area. And then this is what obviously becomes how you create your work that you do. Okay. Looks like I have about 15 minutes, but I want to leave some time for questions. So I'll take about 10 more minutes or so. So the second one was making your proposed work stand out from other organizations. So a couple things that I think are really, really important is to remember that, if funders see the work that you do as an investment of their funds. And I know that's as we talked earlier, sort of an inverse way of thinking of what we'd like it to be, but that's pretty much a reality, an existing reality. So because funders see investing in you as an investment to do the work that you're proposing to do, it's important to understand what is important to them, right? And what they're seeking to accomplish. Also, they want to know that you are going to give the most amount of money in your grant resources directly back to the community. So if there's a way that you can show that the community that you serve is going to receive the most amount of those dollars directly. Funders often get a little concerned when you're spending 75% of your budget on staff, or if one of your staff members' entire position is fully funded by their work. That makes them very nervous. So showing how you can give that money directly back to the community is attractive to them. That you have the organizational capacity to perform the work. This is all about talking about your staff and your team and all the amazing things that they do to serve the community on a daily basis, but being able to do that really well. And then all of you have this now because we're year 10, and that's showing good evaluation infrastructure. As I mentioned earlier, funders see you as an investment. They want to know that if they fund you, that the money is going to be used in a way to do the things that you say you're going to do. So the way that you show them that is through evaluation. So at the end of this 10-year initiative, all of our organizations have this infrastructure. So the encouragement is to maintain that infrastructure. And then partnerships. Funders also want to know that you have strong partnerships with other organizations, and that you have good relationships with other organizations, and that when they fund you, they're not just funding you. If you can establish a partnership and apply for funding, that is more desirable to many funders, because they know that their investment is broader in scope, if that makes sense. The other thing is, in your proposal, be different. Give them a catch. Give them something to attach to. Don't be afraid to use a cultural word that is meaningful and carries power for your community that you serve. Give them something to remember. I'm always thinking of Cuba Gooding Jr.'s Jerry Maguire phrase when he says to his agent, "Show me the money." Right? It's like, what do you want them to read your proposal and remember? Right? So again, using those stories, using that catch. All right, and then the last thing is, how do you use evaluation to demonstrate effectiveness? Evaluation is essentially the way that you provide the evidence to your funders of their investment. You have to evaluate, right? There's just no way around it. But it's important not to overpromise. Right? Be careful when you're writing your goals and objectives that you don't try to do too much, because when you write your goals and objectives, your funder's going to say, okay, you're going to do all this with this amount of money, right? So you want to be careful not to overpromise, right? If you don't have the resources and whatnot to accomplish the things that you promise, that can get your organization in some trouble and stress you out and stress your team out. As I mentioned earlier, partnership. Evaluation means that ingraining evaluation into the work that you do, which again, all of you have been doing that for 10 years. As well as expanding that to the way that you work with other organizations and showing that flexibility in your approach, but still maintaining that attunement to your outcomes and what you're measuring. Again, shows your viability of interest of a particular funder. Make sure you always include both summative and formative evaluation. So those are fancy words for evaluation. It just means that you're both focused on the outcome, right? The needle you said you were going to move in your participants, as well as process. So having a good method for process improvement, quality assurance, quality insurance, all of those things that we call them, your ability to adjust using data when you see that things aren't working, all of those are really important. So evaluation helps to show what outcomes were met. Your instruments should always directly connect to your goals and objectives. We know this already. Sometimes I think we evaluate other things that are unnecessary. Evaluate other things that are unnecessary. I would invite you, especially at this juncture, to look at your evaluation instruments and get rid of questions and things that aren't helping you to address and show your effectiveness. Now is the time to make adjustments. Obviously, we know that sometimes funders are interested in specific things that we have to evaluate for them, but you have a degree of flexibility, obviously, in the other areas. The other thing is that, I've been on this initiative for 10 years. I hear the angst in some of our CRDP family members when they say, oh, we have to do this research project. We have to do this research. Evaluation really isn't research. Evaluation is just showing that you did what you said you were going to do. So I want to really encourage you to not make evaluation like the word taxes, right? Like it's this big, scary thing, because it really is just something that we have to do. It's something we do every time we make a decision in our life. We buy a car. We ask ourselves, was it a good investment? Should I have bought that car? Should I have not have bought that car? Should I have bought a different car? Do I like the color, right? That's evaluation. So really embedding evaluation in your work that you do and the practice of your organization as you move forward is really that's about cultural setting in your organization, showing the importance and showing that commitment. The other thing is use mixed methods approaches in evaluation. That's very helpful to demonstrate increased effectiveness. I think a lot of time we talk about evaluation related to just quantitative numbers and statistical significance. That bores me too, trust me. But knowing the story side, right, including those narratives and those stories, and some of our IPPs do this so impeccably well, and that's important as well. Okay, so in summary, and this is kind of a summary for the whole presentation, so hopefully you feel like I've summarized it. Be aware of foundations, systems of care, in other words, hospitals, etc., and state, federal initiatives that align with your work. I think you heard Catherine say, go to those CPSC meetings, right? Like, I know it's hard to go to everything, but trying to stay attuned to as much as possible is important. Don't be afraid to cross-train. That's what I was referring to when I gave the LSP example of, can you stretch just a little bit to, attach to a different opportunity for funding or a different approach of doing your work that allows you, in some ways you may have to completely change something of your CDEP, but look for those small little stretches that you can attach to. Inclusive and vision-focused leadership means that you're including your staff and your team in the need to have to adjust and bend and grow and be uncomfortable, right? Because I think that that's an approach in a cultural setting that you could also say also relates to what I was just saying about evaluation. Staffing for skill set. Trying as much as possible to, I would encourage you to get somebody that can write grants on your team, if you can. And again, just a plug for those MPH graduates, because they do have that skill set. Knowing where to identify your data and how to organize it to make the case is important. Hopefully I gave you a few examples of what that can look like. Ways to organize, potential locations to find, understanding how data is collected, as well as not ignoring the human case as a part of the work that you do. Stand out by appealing to what is important to the funder. Again, I understand that, we also need to advocate for funders to change the way that they do their work as well. Funders want to know that by investing and funding in you, that it's a low risk investment, that you're going to do the work that you say you're going to do, and that you have the team to do the work that you're going to do, that you're in alignment with the mission of the work that they do, and so that's what they want to know. And then again, evaluation is a tool for your organization. I promise you, it's not the big tax word. It's how you show that you did what you said you were going to do. So, okay. I also attached the areas of preparation that were in a previous training to the end of the slide deck. I'm not going to go over them. Just to give you an idea, these were created as ways that your organization can prepare so that when funding becomes available, you're ready potentially to apply for that grant proposal. But they'll be included in the slide deck, but I'm not going to go over them right now. So I show that we have 3 minutes left. So I'm going to stop and punt it to you.
Can I go
Any
ahead and ask
questions?
yes. Can I ask a quick question?
Yes.
Can you all hear me? Oh, okay, sorry. Thank you so much, Heather. This was really, really informative. A couple of quick questions. Number one, regarding the hospitals. Um, I've noticed they have a department for philanthropy. And so, what is your experience there? Because we've gotten some funds like 7 to 10,000, sometimes 15,000 from a couple, like Sutter, for example, for many years. But I'm wondering if that's a good place to look for many hospitals. Second question is, our CDAP focuses on the Muslim community, specifically Afghan refugees, since Sacramento is the one with the highest population of Afghan refugees in the US. Our CDAP is peer support. So another thing I'm doing is directly going to the community and doing presentations. For example, I did one for a group in the Bay Area. The prize was 100,000. We got the 67 in 1 hour. We were able to get 67,000. So that was
Wow.
amazing. And so this year I'm hoping to do that more. I am new to it, so all I did was present what I knew what to present, and they were happy. So I got lucky. But I'm wondering, do you have experience with presenting directly? Let's say if I were to present to all the doctors that are in our community or engineers or people that work at Google, we have a lot of Muslims that work in these areas. And so if you have experience with that, or anyone I can reach out to help me more, because I think on the first one, it was okay, but and I did, I did get lucky to a certain degree, because their focus was on domestic violence, and we had opened the first one in Sacramento for Muslim women. But in general, as I do this more, I would like to get more training on this. So thank you.
Yeah, no, these are great questions. So, in terms of community benefit, there is a community benefit entity that's attached to each hospital and or health system. Foundational community benefit and is slightly different. For example, Sutter has a Sutter Foundation that's different than the community benefit wing of their various hospitals. There's some crossover going on right now, but those two entities are different. So just to address that particular question, I don't think you asked this question, but oftentimes the community benefit funding isn't ginormous. It tends to be, I don't know, depending on the organization and the complexity of the program, it can vary greatly. But I think my intention is, establishing a relationship with the community benefits officer is important because, here's the reality. What they see in their emergency departments and what they see in their patient care is what their focus is often going to be. So, for example, I live in Carmichael. I think your organization is in the Carmichael area, right?
Close to it. Close to it.
Yeah. So I would think about which hospitals or which emergency departments would most likely be intersecting with the communities that you serve. And it probably, I would imagine, is a little difficult to find data specific to the communities that you serve, right? Because census doesn't organize it like that, right? But those hospital caseworkers and the community benefit officers of those particular hospitals, for example, Mercy San Juan, they know what's happening in their immediate ERs, right? So they're gonna want programming and prevention focused on helping people prevent coming to the emergency room in emergent situations. So sometimes that's maintaining that relationship with that community benefit officer to know what's happening on the ground, figuring out what hospitals, they do a lot of amazing work, but when it impacts their bottom line through their emergency department, they want solutions. And I'm happy to chat with you separately if you want to chat a little bit more about this.
Thank you.
Yeah. Okay. I just want to thank everyone for coming. I hope that you found it helpful. I'm happy to do another training, although Catherine probably don't say that. If there's more specific things you'd like me to focus on, or you want me to go even in deeper dive in certain areas, please fill out the evaluation. And, this is a big topic, so I could have gone a lot of different ways. So I just want to thank you for being here, and I would love to hear your feedback. and have a great day. And see you this afternoon.
Thank you.
Everyone.
Bye, everyone.
Don't forget the evaluation.
Yes, please.
You're welcome, Roland. Thanks, Henry. Appreciate you. See you tomorrow. You're welcome, Caesar.
Thank you, everybody.
I always try not to be too academic, but it's so hard because I just slip so easily into that role.
Because you are one.
I know. I try not to be, but
No, nice job, Heather.
appreciate that.
If it's okay with you, Catherine, is it okay if I stop the recording?
Yes, yes, that'd be great.